Good morning everyone. Let's deal with the new topic, that is kinesiotaping and its 5 main effects. So these are the taping and its effects. Without further ado, let's dive into the topic. So first one, improvement of circulation. How kinesiotape is benefiting while improving the circulation of the injured area. Take for an example this a muscle which has normal blood supply and normal lymphatic flow. When the muscle is cut into two, the blood supply increases in order to heal it. Also, the lymphatic vessel is cut and the lymph flows out of the muscular plane. So this is the increase in the blood supply. This lymph which is flowing out of the plane gets accumulated between the fascia and the muscle. So thus leading to swelling of the surrounding tissue of the muscle. Now when you want to apply the tape on such edematous muscular area, the tape indirectly reduces the edema. Thus, why? Because the tape pulls the fascia and the skin away from the muscle, thus leading to drainage of the exudate, also known as your lymphatic fluid in our scenario, thus leading to reduction in the edema, also leading to healing of the muscle, more easy healing of the muscle. Coming down to the second point, pain relief. When we talk about physiotherapy and pain relief, physiotherapists relieve the pain in two levels, that is your spinal and supraspinal. Spinal level is by your pain gate pathway and supraspinal level is by stimulating other fibers which pick up the different signal rather than pain. Taping is the best example for supraspinal level inhibition. Coming down to how the tape decreases the pain. Take the same example, the edematous muscle which is torn, the lymph is flowing out, getting accumulated between the muscle and the fascia. This is edematous, this will definitely develop pain. This is sensed by A delta intice fiber which is passed to the relay station, that is your spinal cord. From spinal cord through lateral spinothalamic tract, it is further passed to the brain which is sensed as pain. When we apply the tape on such muscle which is edematous, which is cut and torn muscle, instead A delta and type C fiber, the touch fibers are sensed. The touch fibers are stimulated because of the presence of tape, which are passed to the relay station. The pain is not carried, whereas touch is carried to the spinal cord, which is further carried to the brain and sensed as touch. This is how kinesiotape decreases the pain. Coming down to third important point, improvement of muscle function. When we talk of muscle dysfunction, it can be into two main forms, weakness and tightness. Weakness, everyone knows, the muscle is injured, the muscle is definitely undergo weakness. Coming down to tightness. Tightness doesn't occur suddenly. First, once the muscle is weak, it will go into overactivity. Overactivity of the muscle, if not trained properly, will lead to spasm. Spasm is a protective reaction, the guarding reaction by a muscle. If spasm is not treated, the muscle will land up into tightness. The origin and insertion of the muscle will come closer. That is nothing but your tightness of the muscle. Tightness, if not treated, will land up definitely into contracture. Contracture is a state of muscle which cannot be stretched. Origin and insertion cannot be made apart. Contracture, the specific treatment for contracture relies on the surgical intervention only, whereas tightness, spasm and overactivity can be treated by conservative management. Let's look into point where kinesiotape, how it acts on muscle weakness scenario and muscle spasm scenario. First one, muscle weakness. Take down an example of elbow joint, and this to be your biceps brachii. We know that the main action of biceps brachii on the elbow joint, I'm not talking about the forearm, on the elbow joint is elbow flexion. Muscle contracts leading to elbow flexion and muscle relaxes leading to elbow extension. Now this is the action of the biceps brachii at the elbow joint. If the muscle is weak, apply the kinesiotape on the muscle in the direction of the muscular plane, so that it acts adjunct to the muscular action. Make sure you remember that kinesiotape is an adjunctive therapy. It is not a mainline therapy. So when you want to give kinesiotape, when you want to apply kinesiotape on a particular patient, you have to apply kinesiotape along with the other rehabilitation protocol. So once you want to train the strength of the muscle please make sure you have to apply kinesiotape along with which you are going to start strengthening protocol for that particular muscle. Recently, I read an article suggesting that kinesiotape enhances the aerodynamic performance of an athlete. I'll put the link in the description box below or somewhere on the slide. Please click the link to read about the full article. Coming down to the effect on the muscle spasm. Imagine this to be a muscle spasm, as I told, occurs due to hyperactivity or overactivity of any muscle. So muscle spasm, usually the muscle is swollen. Why? What is the reason why the muscle is swollen? Because due to overactivity, the lactate dehydrogenase, the waste product after the muscular contraction, gets accumulated within the muscular plane, that is within the muscle and the fascia. This accumulation will lead to muscle spasm. What the kinesiotape will do? On application of kinesiotape on such area of the muscle, the pull is exerted on the fascia, thus creating space between fascia and the muscle, thus leading to muscle size reduction. That is, swollen muscle will get reduced because the spasm is the fluid is drained out, the exudate is drained out, the lactic acid dehydrogenase is also drained out, thus leading to decreased muscle spasm. Coming down to the last point, that is joint support. Joint support, when we are talking about the main tapes which are going to act on joint support, is your athletic, rigid, elastoadhesive bandage, also partly meconal. Kinesiotape is dynamic, hence it will mostly act on the soft tissue, that is your contractile muscular tissue, also on the non-contractile, that is your ligament, and the least contractile, that is your tendon. While talking about joint support, remember, when we move the joint, there are proprioceptors which are activated, which tell the brain what is the position of the joint and what is the direction of the movement. Mechanoreceptors sense the load on the joint, whereas the skin proprioceptors sense what is the direction and what is the position of the joint. So thinking about the same thing, take an example of this to be elbow joint. This is your bicep brachii. Normal action of bicep brachii at the elbow joint is your flexion. When we talk about any tape, any of the tape system, that is not only kinesiotape, we apply tape on the skin. Except meconal can be applied with a glide on the joint. Also athletic can be restricted in a motion. So kinesiotape is applied on the skin where your proprioceptors of the skin are present. So when you want to do the movement, this proprioceptor senses the movement of the kinesiotape, passes it to the brain, thus sensing the movement of the joint. This is how kinesiotape can act on the joint support system as well. So thank you. This was the end of the lecture. Let's meet you all in the next lecture.